Hi all, welcome to the newer module of Geriatric Interprofessional Education. In this you will be learning about case-based learning module to understand interprofessional education. These are the contents: interprofessional collaboration in geriatric care. Learning objectives are here: shared decision making, interprofessional collaboration, managing the conflict. Coming to the introduction, the aim of this module: to develop students' ability to create collaborative care plans, demonstrate interprofessional collaboration and manage interprofessional conflicts within a patient-related context. These are the learning objectives: create a collaborative care plans, develop a patient-centered care plan using shared decision making, demonstrate interprofessional collaboration, work effectively within a healthcare team to support patient, client and family needs, manage interprofessional conflict, explain the nature and potential sources of interprofessional conflict and strategies to resolve them. Introduction to geriatric oral healthcare, overview of the case-based learning, an educational approach where students apply theoretical knowledge to real-life scenarios, enhances critical thinking, clinical reasoning and interprofessional communication. Basically, this is a presentation of the case. Now we can go through the case. Here we have Mr. John Doe. His background is 78-year-old male with a history of diabetes, hypertension and mild cognitive impairment. Current issues are frequent hospital administrations due to uncontrolled diabetes and hypertension, recent falls and difficulty managing medications. Living situation: he lives alone, limited family support, uses home health services intermittently. Creating a collaborative care plan. Activity is to developing a care plan. Now how can we do this? Step 1, conduct a comprehensive assessment: medical history, current medication, social support, cognitive status and functional abilities. The step 2 would be identify the patient goals and preferences. Discuss with Mr. Doe his priorities, example, staying independent, managing pain, reducing hospital visit. It's easy for you to suggest him to go and check into some hospice care where his needs will be taken care, but discuss this with the patient. Step 3 would be to develop a multidisciplinary care plan. Involve various healthcare professionals, for example, primary healthcare physician, endocrinologist, physical therapist, social worker or a pharmacist. This is just an example where I am giving all of you. You can use this example in your module as I go through in your sessions, and some exercises will be given to all of you to answer to these questions. The care plan, here I have given a simple care plan according to me. You can discuss the various variations as well. Medical management would be to adjust diabetes and hypertension medications, regular monitoring by a home health nurse, and physical therapy for fall prevention and exercises, home safety assessment and modifications, social support, connect with the local senior services for meal delivery, arrange for regular check-ins by a social care worker, and patient education. Teach Mr. Doe and his family about his medication management, signs and complication. Now this is one example I have given all of you. Now all of you can sit together and decide for different types of plan, different ways of managing this case by using different healthcare professional students. So basically in these few slides you will come to know how this interprofessional collaboration works. Basically interprofessional collaboration is working together across disciplines to provide a comprehensive care. Benefits are improved patient outcomes, increased patient satisfaction and more efficient use of the resources. Activities are for you role playing exercises. Basically students can take on the role of different healthcare professionals and simulate a team meeting to discuss the Mr. Doe's care plan, focus on communication, role clarity and shared decision making. Demonstrate interprofessional collaboration. Key strategies basically are effective communication, and you can use SBAR technique. It is called as situation, background, assessment and recommendation for clear, concise information sharing. Role clarity: understand and respect each team member's expertise and contributions. Shared goals: basically align team efforts around the patient-centered objectives. Managing interprofessional conflict: basically you can do this by attending quizzes, reflective journals, group projects, and peer and self-evaluations. Basically, when you are working as a team to solve the problem of Mr. Doe, and naturally a doctor or a dentist or a nurse or a social healthcare professional will feel they have a major role to play. But when you are in a team meeting, you can always discuss who has to play what role. Now basically a simple example would be when the patient comes into the medical emergencies, it would be the role of the doctor to assign respective the nurses or the healthcare professionals their roles in managing this case, and when the patient goes back home, it would be the responsibility of the social care worker or the MSW workers to take care of the patients from there on, so that he can reduce the number of hospital visits to the hospitals. To conclude, this module emphasizes the importance of interprofessional collaboration, shared decision making, and effective management, conflict management in providing optimal care for geriatric patients. The next step would be apply these principles in clinical settings and continue learning through advanced training and real world practice. Thank you.